as I like to call this course, How to Make Things Right. My name is Juan Carlos Villalobos. I'm a pediatric dentist that works as a full-time assistant faculty at the University of Louisville School of Dentistry. Louisville is located in the bluegrass state of Kentucky, USA. I will be serving as your coach on this semi-asynchronous course. My history at Anahuac University comes from many years ago. I used to be the coordinator on the Pediatric Dentistry Academia, where patients were seen by a preventive and comprehensive pathway of care. Being a successful program, I took lead of the Prevention Academia. I taught the prevention class, setting a specific approach by Carey's risk programs in Anahuac Norte Clinic. I had a successful private practice during 25 years in Mexico City. But I decided 3 years ago to be part of this fantastic team of faculty teaching DMD students and grad pedo residents at ULSD. Now, that being said, I would like to start this course with this overview on evidence-based research. When dealing with problems, there are different ways to attack them. There is within the human being an instinctive way. It is performed as an aid without further reflection in an intrinsic way. Some likes to consider a magic way, where hidden knowledge is used only in the hands of initiates. When talking about dentistry, there is a routine way. It appeals to a certain way of doing things just because it has traditional being done like this. But we prefer to base our treatment on the technique way, and that doesn't mean with the newest technology or gadget, but by doing things rationally. An action is rational if it is best suited to achieve the given objective, using the best knowledge available. Therefore, this involves making a critical assessment of existing clinical knowledge, both diagnostic and prognostic, or even therapeutic. Today, information flows in a variety of ways, is streamlined day by day, and becomes relevant when it comes to a healthcare decision on a practice. Evidence-based decisions increase the chance for both the dentist and his patients to access reliable clinical findings and conclusions. Evidence-based care is a global movement that encompasses all areas and disciplines of health sciences. It represents a change in philosophy, in focus, and the way we practice. Dr. Sackett defined first in 1997 when described it as the integration of extensive individual clinical experience with the best clinical evidence obtained from scientific research. American Dental Association defines evidence-based dentistry as an approach to oral health care that requires the judicious integration of systematic assessments of clinically relevant scientific evidence relating to the patient's oral and medical condition and history, with the dentist's clinical expertise and the patient's treatment needs and preferences. This definition emphasizes 3 core components: best available scientific evidence, gathered through systematic reviews and critical appraisal; clinical expertise, the dentist's experience and judgment; patient needs and preferences, including their values, expectations, and unique circumstances. Evidence-based dentistry does not determine clinical decisions per se. It makes them sound. Decision-making is made by the clinician who applies the evidence, and in practice, tries to bridge the gap between proven knowledge and what is carried out. Take a moment on this. When people face 2 choices, they can make effective decisions, like when you offer a patient between 2 different treatment plans. But what if there is more? With more than 3 options? People tend, and I'm referring to the dental practitioner, to lean toward what they've always done. Evidence-based for decision-making is today the best tool for dental professionals. With it, the clinician can provide the highest quality care and avoid problems of misuse, excess, or lack of knowledge in specific care interventions, better knowing not only the existing alternatives, but their results in the current practice. The most important thing about review of the evidence will be to combine it with our experience, using it as a tool that can help us to support a decision in the office.